Welcome, everybody. We have Dr. Alma Sheikh on here, who is our board member for AMP. We have Dr. Gala Khan, who is our ED. And then, of course, Dr. Tony Nguyen from the CDC, who is the CMO for NHANES. And so we're really excited to be here. We're really excited to use this space today to discuss what the NHANES looks like, what that means for you all, and what that means for your communities, as your support goes a really long way since you have that direct connection to the community members that NHANES is trying to reach. So if you haven't done so already, go ahead and put your name in the chat, what organization you're here with, and then something you're looking forward to today. And if you already have a question, go ahead and throw it in there. But that is my brief intro. In respect of time, I will pass it on to Dr. Nguyen to go ahead and get started for today.
Awesome. Well, thank you again, everybody. I think most of you were here. But we really appreciate AMP and the support that we're receiving to really promote NHANES and let you know what we're about and what we're doing and what our mission is, right? And so I think some of the questions that I got are great because it really encompasses what we try to tell our participants and all of our partners out there to really say why NHANES is important and how it helps both at the individual level and at the community national population health level. And so, as you said, in the interest of time, I want to be able to get right into this, and I want to be very succinct with how I do this presentation because I want to allow for more questions and answers at the end, and I want this to be really interactive between all of us, so that if there are any questions that I haven't answered, I want this to be really a good forum to be able to answer those questions for you. And I will caveat and start with this: I love NHANES. And so I can get really excited and talk really fast about it. So if there's any point where you are confused or I start to slur my speech because I get so excited, please don't hesitate to just interject and go, hey, dude, you got to slow down for me and be a little bit clearer. I'm perfectly happy to reiterate what's going on from that standpoint. But I think based on some of the discussions that we had before, I think the best thing to do is to really just give you two videos that NHANES has produced. And what these videos will do will really encompass how we do things, where we do things, and how we go about doing it. So the first one is just the video that we show to our partners and our communities when we go there. It explains to them how we got to where we are with them at this point in time. The second video that I'll show you after a little bit is the in-depth details about what's actually inside our mobile exam center. And I hope to give you more information about that. But there's one thing that I actually, now that I'm talking, forgot to explain to you is really just to introduce me, right? To see who I am and what I do for the program. As you heard, I'm the Chief Medical Officer for NHANES. And so I'm a pediatrician by training. And I'm also a public health epidemiologist or a medical epidemiologist with CDC. After residency, I did a couple of years with the Army, played Army for a while. My wife said, you know, playing Army in Iraq was not fun for her. So I said, okay, fine, I'll leave. Went into private practice, did it for a little bit, and it was great because I got to go home and take care of my friends' kids, actually, which is a really unique thing. And I really loved it, except for the fact that I hated the business side of medicine. And so that kind of drove me to look at other options. And I joined the local health department and loved it. Best job I ever did, right? It was the best way for me to actually use my clinical brain, be clinical, but at the same time, get back into the community and really see what's important, to see how I can help. And it really solidified my love of public health and working at the population health level. So I applied to the CDC's Epidemic Intelligence Service program, which is an applied epidemiology program where you learn epidemiology, you do outbreak investigations, you do all this other stuff. And I was assigned to NHANES. Never heard of NHANES before, ever, even as a pediatrician, never heard of it. And then now I fell in love with it, right? So after my EIS time, I ended up staying on as the medical officer and chief medical officer. And here I am 8 years later. But my role now is to really do a couple of things. First and foremost, I am the person that helps to oversee the health examination portion, that everything that we do is done to a standard. Because as you all know, and as you will hear, we pride ourselves in making sure that the data that we present and that we release to the public is done in a very standardized manner. So that, for instance, if you step on one of our mobile exam center scales and you are 65.2 kilograms, you sure as heck better be 65.2 kilograms on all other mobile exam centers. When we measure blood pressure for you on one way in one exam center, the team doing it at the other exam center should get the almost exact same answer because of the standardized way and how we're very, very meticulous. And not to a fault, we are what I call unapologetically OCD about how we do things, because we have to be very sure about how we do that standard. So I help oversee that. The other job that I have is to really be the point of contact for medical providers and participants if they have any questions regarding their test results. Anything from why do I have high cholesterol, or to why do I have a high arsenic or lead level in my blood? All those questions come to me or through me, and then from there I can work with them to really figure out what's the next best step, whether it be clinically or whether it be for public health. We can go through all of that. So those are my main jobs. And then what it's branched out to be is to be part of these outreach things where I'm able to go talk to public health agencies and medical schools and public health schools to really get the word out about NHANES. And so, yes, I kind of hide behind NHANES to promote NHANES, but the selfish component for me is I love to talk about NHANES, and I love to talk about how great it is, because I would love to build up the public health workforce, right? Talking to med schools and public health schools to see and show these students there's more to medical school than just clinical medicine and being in an office every day, right? There's more to public health and epi than just outbreak investigations, right? There's this whole world of chronic disease epidemiology and public health and how you can make a huge difference and impact when most people probably don't even know what you're doing it. And that's what I love about it. It's very quietly impactful. And so that's a very long-winded story of me, but I wanted to get you to understand of where I am at and why I love NHANES. So with that, I think we've got a couple other people just to join us, which is wonderful. So I'm going to start the video now. This first video is really just a video to tell folks, NHANES is coming to your community. So let me get that going. I want to make sure I share sound. Optimize that. All right, and hopefully you will be able to see it. If you don't, please tell me that you can't, because I don't always see the audience once I start sharing.
We see it.
All right, here we go.
The numbers are in, creating the most accurate picture ever of our nation's health. And one national survey plays a prominent role in improving the health of all people living in the United States. NHANES. NHANES, the National Health and Nutrition Examination Survey, is the only nationally representative survey that conducts home interviews and actual physical exams. The data from interviews and exams completed in your county, combined with that from other counties we visited, provides a current picture of the health and nutritional status of people living in the U.S. NHANES data help inform research and shape policy by identifying key trends in health and nutrition and shedding light on emerging health issues. NHANES started in 1960. We've traveled to hundreds of communities across the country and conducted examinations on more than 240,000 people. Since 1999, 15 counties are visited each year, where we examined approximately 5,000 people. NHANES field interviewers collect information about the health and eating habits from one or more people living in every sampled household in each county. Once interviews are complete, the selected household members schedule their physical exams. The exams happen here, inside state-of-the-art mobile examination centers. They're performed by teams of health professionals working with the National Center for Health Statistics, which is part of the Centers for Disease Control and Prevention. Each team of examiners includes a nurse, a phlebotomist, skilled laboratory and health technicians, and other health study professionals. The NHANES exam varies by age group and gender. It can include height and weight measurement, body composition, blood and urine collection, and a private health interview. The health and safety of NHANES participants is our highest priority. We follow all CDC guidelines for use of PPE, cleaning standards, and gatherings. Exam participants are performing an important service for their country, as well as taking action to monitor and improve their own health. At the end of each exam, we provide a token of appreciation for their time and effort in the form of a debit card. We also give them results they can share with their doctors. Data from NHANES serve an important role in monitoring the nation's health and are critical to the work of public health leaders and decision makers. Government agencies and private sector organizations use NHANES data to establish policies and plan the research, education, and health promotion programs that make a difference today and may help reduce health problems in the future. For example, in the late 1970s, after NHANES data revealed a disturbing number of Americans had high levels of lead in their blood, Congress introduced legislation to remove lead from gasoline and paint. Over the next 2 decades, NHANES data monitored the decline of lead in blood. NHANES provides national estimates on HPV infection in girls between the ages of 14 and 19. These data have helped to shape prevention policies for HPV, which can cause cervical cancer in women and other cancers in both men and women. And since the introduction of the HPV vaccine in 2006, NHANES data have shown a dramatic decline in infection with the HPV types targeted by the vaccine among 14 to 19-year-old girls. NHANES data have been used to identify the need for programs to reduce hypertension and high cholesterol, provide data for pediatric growth charts to track children's physical development, show the importance of fortified foods in helping to prevent birth defects, and inform recommendations for nutritional labeling. You may wonder why, out of over 3,000 counties across the country, yours was selected for the NHANES. Your county was selected randomly to represent other similar counties across the U.S. using a scientific process and information gathered by the U.S. Census Bureau. First, we divide all counties in the U.S. into 15 groups based on their characteristics. One county is selected from each group, and together they form the 15 counties NHANES visits that year. Then within each county, smaller groups, like neighborhoods or groups of blocks, each with a large number of households, are formed. Approximately 20 to 25 of these smaller groups are selected, and all houses and apartments within these areas are identified. Finally, an average of about 30 households are selected within each group and asked to participate in NHANES. Each household is asked general information about the persons living there. A computer algorithm then randomly selects household members to participate in NHANES. Each person examined in your county may represent as many as 65,000 or more similar people across the country. By joining in an effort as vital as NHANES, your county becomes part of something bigger, with meaningful, lasting impact. We are so pleased that your community will play a major role in the upcoming NHANES. Your assistance and support during the next few months will influence the health of the U.S. population for decades to come. Your participation is critical to our ability to advance knowledge that guides future research, policy, and education initiatives. We look forward to working with you on this important effort to improve our nation's health, one community at a time.
All right, I have one more video to show you. I'll go back to that.
Welcome to the National Health and Nutrition Examination Survey, otherwise known as NHANES. Our mobile exam centers travel across the United States to capture a picture of our nation's health. Our mobile exam centers are comprised of 4 specially designed trailers that, once interconnected, create a special suite of medical stations. The CDC and NHANES takes your health and safety seriously. Prior to entering our mobile exam center, everyone will be screened for COVID-19 symptoms and then be given a free medical-grade surgical mask to wear during your exam. In addition, all NHANES staff will be screened daily for COVID-19 symptoms and be wearing personal protective equipment during your entire examination. Once inside, an NHANES staff member will greet you and get you checked in. You'll be given a bracelet with a barcode that's specific and unique to you. Next, you'll be given a set of medical gowns to wear during your examination. Our NHANES exams will last about 2 to 2.5 hours, depending on your age. In the phlebotomy room, your blood will be collected and tested for medical conditions such as anemia, high cholesterol, and diabetes. We will also check for infectious diseases such as hepatitis B and C, and environmental concerns such as high lead and mercury. In our state-of-the-art laboratories, our certified NHANES laboratory staff will process your blood and urine samples. Your test results are going to be an important piece of us understanding our nation's health as we recover from the COVID-19 pandemic. In this room, the health of your liver will be examined. This machine will use ultrasound technology to measure how fibrotic or stiff your liver is. This information will be important for us to understand if you have any signs of liver disease. Each year, over 3 million adults are treated in emergency rooms after falling, with medical costs totaling over $50 billion. Depending on your age, your balance may be tested during your exam. This will provide important health data to determine factors of someone's increased risk for falling. In this room, this machine will determine your body's composition. This test looks at how much muscle mass and other tissues that you have and how it relates to other conditions such as diabetes and cardiovascular disease. In addition, this test will allow us to study the association between your lung volume and other chronic health conditions such as COVID-19 related diseases. NHANES blood pressure data has been critical to understanding the cardiovascular health of our nation. Our data has been used to understand and estimate the prevalence of undiagnosed and uncontrolled high blood pressure in our nation, especially among those minorities that we know is at increased risk of developing cardiovascular disease. This is just one example of how NHANES data can be used to understand the health disparities in our nation. A few people might find that some of our questions are very personal in nature. We want everyone to feel as comfortable as possible, so we will answer questions in private on a computer like this. Our NHANES staff will show you how to answer the questions before leaving the room. By participating in this part of our exam, you will help researchers have a better understanding on mental health and physical activity in our nation. In this room, your height and weight will be measured to calculate your body mass index, or BMI. This number is critical for us as we monitor the weight of our nation. NHANES data on the height and weight of children were used to create the pediatric growth charts that are used in doctors' offices today. By allowing your child to participate, you will help healthcare providers track and monitor the growth and development of your child. Our examination center has 5 multi-purpose rooms that will allow us to do multiple tests in one location. These rooms will help us with our COVID-19 protocols to make sure that it limits how much interaction you and your family have with other participants in our exam center. Capturing the health status of individuals with disabilities is an important piece in determining the health of our nation. For participants with physical disabilities or who cannot walk up the stairs to our mobile exam center, we have a lift that will be able to bring you up. In addition, for those that require it, we provide medical transportation at no cost. A few weeks after your exam is complete, your results will be mailed to you. Please know that the NHANES program takes your privacy very seriously. Your individual information will not be shared with anybody except for you. Thank you again for your participation in NHANES. We hope you know how much your involvement means to protecting your health and that of your community.
All right. I hope you all enjoyed watching that as much as I hated making it. But I think both videos give you a pretty good synopsis of what we do with NHANES. And before I go on, I want to stop there to see if there's any current questions. I don't know if there's any in the chat yet, but I'm happy to stop now and answer any questions as we that folks may have right now.
I don't see a question in the chat, but Rima, I see your hand up. Do you want to state your question?
Yes. Thank you for those videos and the information. It answers a lot of questions. However, it brought a very interesting idea. I'm a founder of Global Hope 365. It's a 501c3 nonprofit. Our goal is to end harmful practices against women and girls, such as child marriage, human trafficking, and other forms of gender-based violence. The research that's indicated, I wonder if one of the questions is at how old when you were married, because we would like to know confirm the harmful effects on young girls if they're married before the age of 18. Is that one of the questions? That's my first question, and then I have another one.
I don't believe we asked specifically about age of when folks are married. It's a good point, and I think one of the things that we're looking forward to on a broader scale is seeing how NHANES can help with some of these social determinants of health right now, right? That's a lot of what you're talking about, and we know that that's something that needs to be addressed much better. And as we move forward into our future NHANES that we'll be implementing in 2025 now, it looks like, it is one of the big forefront ideas that we're looking at is what questions do we need to ask to make sure that we're able to figure out and help researchers and stakeholders understand what these social determinants of health are, and how is it done at a population level. So to answer your question, no, it's not there, but it's definitely at the forefront of what we're thinking about for the NHANES of the future.
Great, thank you. Because there has been 300,000 minors married in the US between 2000 and 2018, mostly young girls married to adult men. So it's very important for us to confirm the harmful effects physically, emotionally on these young girls.
Absolutely.
The other question is, I know about collection of the blood. I have a very close friend who's a doctor who, when he took a blood sample, he put them in a, forgive the wrong name, in a centrifuge, and it has to be saved in a certain temperature. He said that's the best way to preserve the blood in order to get accurate reading. Is that done with the blood samples that's collected here?
Hands down, without a doubt. I wish you all could see the ballet that we have with our laboratory scientists that happens, because every sample has to be handled differently, right? Some need to sit for 24 hours. Others need to be spun down right away and then separated. Others need to be spun down and then the serum and or the blood or the plasma gets taken off and then it has to be frozen right away. Others need to be refrigerated. There are so many tests that we do. We do hundreds of analytes, and each test and each vessel that we have has to be handled in a different manner. And so it's all done by our clinical laboratory specialists or scientists. And yes, so our shipping actually happens twice a week, but it all depends on what that specific lab needs. And that is all done in the back. And so you saw a little bit of the video of that lab back there. There's three folks that work back there, and there's a biohood where they're able to separate and spin down and do all the other details of words that I probably don't even know about, but they get done back there.
Thank you, Rima, for those questions. We have a question in the chat. Would translations or translators be provided, and will they be actively available through the conversation?
Absolutely, without doubt, yes. And so what we do is before we show up to a certain location, we always ask to see if there's certain languages that we need to anticipate, right? So in Orange County, there's obviously languages that stand out, and then there's others that we may not know about, and so we'll be able to do that. So there's some locations where Haitian Creole is very important, so we were able to lean forward and be able to have documents that are translated into that, and we can bring in translators. We do everything we can to make sure those translators are there if the families can't help provide that. And what I've learned, as you all may already know, is that I should not have gone to medical school. I should have just been much better with my Vietnamese, because then I can make a lot more money just doing translations for everybody, because it is ridiculous how much they cost. But we do it because we know how important it is. And so no cost is spared along those lines.
That's amazing. Another question in the chat. How has the CDC worked to address mistrust amongst marginalized communities who have historically been harmed by the medical community? Have you seen the impact? Have you seen community willingness to participate impact the NHANES survey results?
Yeah, it's a great question. And, it's one of those things that we always have to worry about and think about. And so we do have, using the perfect example was like the Tuskegee project, right? Of making sure that everybody understands that. And so we have documents if we need to, or flyers to help address that. But the biggest thing that we do to really enable trust in CDC pre-pandemic is, to be upfront, I don't think anybody thinks CDC has a great reputation right now, right? So being able to do the outreach and get into communities and talk to folks at the local level, at what we have in terms of each community, to see who is influential, who is important, and talking to them and really hoping that they are able to have about 5 minutes to hear about NHANES, why it's important to not just the health of the country, but how that can impact that community, that population. And really just doing that outreach is really the biggest thing that we can do. And so starting, with this group, starting with the Orange County Healthcare Agency, right, and getting the word out and finding the partners like you to get the word out, to tell your folks, whoever is part of your organization, to say NHANES is real. We actually do go door to door. We will knock on your doors. We are legit, because before the video or before understanding, like if somebody came to my mom's house and said, I want to come into your house, ask you a lot of weird questions, and then you're going to go into these 4 trailers and I'm going to do a whole bunch of exams and take your blood and do all these other things, I'd tell her to have them wait right there, and I'm on my way to talk to them and meet them, right? So it's getting that trust is half the battle. It's actually probably 90% of the battle. And so doing the outreach, doing the press conferences, getting out there so that people see us more, and repetitively. One of my med school professors used to always say, repetition is the key to mastery, right? So these homes that we have randomly selected, we will send them letters, not once, not twice, but 2 or 3 times. We'll knock on their doors. We hope that they see us on social media. We hope that they see us in the newspaper, or on the radio, and on TV, so that by the time we do knock on their door, they're at least familiar with us. They may not want to talk to us, but at least they're familiar with us. And then we can go from there.
Yeah, no, thank you for that detailed answer, and agreed, repetition is key. Learned that a lot in nursing school too. Dr. Aziz, I see your hand is up. Would you like to state your question?
Yes. Hello, Dr. Nguyen. Thank you very much for that explanation. And really, this is something, I'm a pharmacist by profession, and I'm still a pharmacist. However, I am the founder for Sabil USA, which helps indigent community members, immigrants, and refugees. So we deal a lot with our communities. My question for you, if we decide on a location like Westminster, would you be able to have somebody go to their location and do the services there? Or you already have pre-planned specific locations that the collections will be made?
Yeah, absolutely. So the answer is yes and no. In terms of the health examination, it can only be done at our mobile exam center, and that's going to be at the fairgrounds in Costa Mesa.
Okay.
Our mobile exam center is kind of a misnomer, because they do travel around the country, but once they get set in place, they are set in place. And the reason for that is it's 4 big tractor trailers. So it's hard to move around certain counties. And then when we get set up, we need power, water, telecommunications, and sewer lines all set up. And so that can't be done in most communities. And so we stay in one place that we hope is at least centralized within the county, if not easy to get to via public transportation or highways, and we get there. But with that being said, if there are locations like at Westminster where participants may feel safer for us to ask them their health behavior questions and do our home interview portion of the exam or of the survey, we are happy to do that. We're happy to accommodate and do these interviews either by phone, if that's more comfortable, or if they want to do it in person at a location that's safe and convenient for them. So whatever is best, works out best for the participant and for those home interviews is what we'll do.
Okay, thank you.
Sure.
Great question. One more question in the chat from Petra. Would the blood work include rare diseases? Also, will this survey include results based on zip code in the sense of connecting pollution and health of the community?
So it does do some rare diseases. It depends on what you're talking about, right? So when we do NHANES, everything that we do is something that needs to be done at a national public health level that we know will be impactful, right? So infectious diseases like hepatitis and herpes and HIV, we will definitely do. There's other things that we may check that may not be important yet to the grand scheme because we don't know if it's important yet, right? And the perfect example are environmental exposures, like PFAS and PFOA, if you guys know what that is a huge environmental concern that may cause cancer that everybody is really looking at it. And it's more important in some aspects of some parts of the country than others, but it's definitely something that's important for us. And what NHANES has been doing over the last 20 years is tracking that. And so we'll be able to do that. And so rare, yes, we to a certain extent, we will be able to do. And I'm sorry, I can't remember what the second half of that question was.
Have the participants already been selected? Oh, sorry, that was actually Dr. Almas's next question. Let me go back to Petra's question of, will a survey include results based on zip code?
Yes. So because of our survey, we are nationally representative. Our actual results are all done at the national level. So when we're sampling Orange County, this sample isn't actually representative of Orange County, it's representative of the entire nation. And that's how we've had statistically done it, so that everybody, as you heard, represents 65,000 others just like them, right? So obviously Orange County has a much higher proponent of Asian Americans, right? So all those Asians will represent other Asians within them, or even if there's other races and ethnicities and social economic groups, you will represent the same thing. But we definitely go to different pockets to make sure that we're nationally representative. And so it's even difficult at the zip code level because we may not go to all zip codes in the county because everything is very randomized.
Awesome, thank you. Asma, I see your hand up. Do you want to state your question for us?
Sure. I was just trying to type it into the chat. This is Asma Ahad from the Islamic Food and Nutrition Council of America.
Yeah.
We look at addressing food and health security needs of the Muslim population, both in the national level and on an international level. And I'm wondering if the NHANES study that you guys are doing are going to include questions around access to proper nutrition, especially like proteins and culturally sensitive or proteins that meet, not just proteins, but just food in general that meets religious dietary requirements, and look into how that impacts overall health.
I cannot say for sure that we look at specifically cultural type of foods that are made, for instance, like halal or anything like that. I don't know if we do that. I can double check and get back to you, but I don't know if we get to that extent. What we do, as you probably know, is that NHANES does contribute, and if not put a lot of data into the FDA or USDA's What We Eat in America program, right? So our nutrition and dietary interviews really encompass everything that folks have eaten over the last 24 hours, and we do it twice. And so we do definitely want to look at and address things like food insecurity and what people are eating to get that component of health in America, because we know how much food insecurity and even food deserts contribute to so many other aspects of health, whether it be true physical health and cholesterol and other things, and even mental health. We know how important food insecurity can contribute to things like mental health. So I don't think I fully answered your question because I don't think I have an answer for that, but we can definitely look into that.
Great, thank you.
Awesome, thank you. Another question in the chat from Dr. Almas. How far into the process is the NHANES survey? Have the participants already been selected? Are interviews currently being done?
So yes, so we are in Orange County right now interviewing folks. We will have an open house on January 31st. From what I understand, there's going to be a press conference that morning. I think you guys see, or some of you will see, Mercy Alvarenga. She's our public affairs folks from NHANES. She's part of this just to listen in on this. But we do have a press conference planned to reiterate that with everybody. But we are currently interviewing and knocking on doors. And I think we've had a tepid response thus far, understandably so. But I think we hope that as time goes on, we'll be able to get more folks to participate. In terms of where we're at with the whole production, we are now in our second year after coming back from being on a break because of COVID. We had been in the field continuously since 1999. And when I say continuously, I mean literally our staff travel around the country and live out of their hotel rooms 48 weeks out of the year. And then they've been doing that forever. And then we had to stop for about a year and a half for COVID. And we started again last August, or not last August, August 2021. So we are now at the middle part of our second year. And this year will probably end sometime this summer. And then we'll go from there.
Wonderful. Mercy, thank you for joining. Welcome. Hello. Side note, Mercy just put in a note in the chat saying the open house is February 3rd, and it's an open house and media day. So y'all can note that down. Another question in the chat from Arifa is transportation to the physical exam provided only for disabled individuals, or is it for any individual who does not have transportation to get there?
Anybody. So we're going to go into this because that's one of the questions I had before, but I might as well go into it now. So it's great. So we reimburse anybody that comes to our mobile exam center, and it's based on the mileage that you have, right? So if you drive, you'll get reimbursed. And this is more for a household, right? So if you have a household of 4 and dad drives, then everybody will, just one person will get that transportation reimbursement. But if we have to separate your exams and dad and baby come one day and mom and son come a different day, then you'll get reimbursed twice. If you have to take an Uber or a taxi or take a bus or other public transportation, we will also arrange for that. And there's some times, and it happens quite often, where some of our participants love our field interviewers so much that go into their home and ask questions. They won't go with anybody else other than that field interviewer. So yes, we will come and we will pick you up and we will take you to the mobile exam center and take you home. Whatever is best for that participant, we would do everything we can to make it easy for them.
We love that.
Actually, one other thing, and along those same lines, we will also reimburse for childcare and elder care. So if mom is selected to participate but not baby, we will pay for somebody, it doesn't matter who, to watch that baby. So if grandma wants to come and watch the baby during this time, guess what? You can get childcare reimbursement for that. We understand.
That is great news. Dr. Aziz, I see you have your hand up.
Yes, that's very generous, Dr. Nguyen. That's very, very generous program. I hope everybody can participate and really take advantage of it. My question is, we get a lot of our foods from Second Harvest and Food Finders. Lately, the food that we're receiving is really not healthy food. We're not getting fruits and vegetables. We're not getting the dairy that's expected. And with the prices of the eggs are not being produced anymore. So does your results reflect how far back on the system when you're taking the blood work and everything? Does it go years back? Does it go 3 months back? How is that reflective on the current food nutrition that they're receiving?
Well, the blood results that we have are at that point in time, right? We are a snapshot in time for that participant. So our data for whoever was participant in August 2021 will represent what their intake is at that point in time. And what that reflective is. And so when we release our data set, it's over the course of a year, right? So it's hard to say whether or not the intake changed over that course of the year because we take collectively everything that was done within that year. You can do changes from now year to year or previous to that every 2 years, because we used to take our data, take 2 years worth and combine it together so that we had a much more stronger statistically powered data set so that we can make estimates. But with that being said, what we do with NHANES is we literally will ask somebody how much they've eaten over the last 24 hours, right? And I'm going to go into that with 1 or 2 slides in a little bit, but long story short, we just don't ask you what you had for breakfast and you say cereal. We're going to ask you what cereal, how much cereal, did you use milk, what kind of milk, did you use whole milk, skim milk, 2% milk, oat milk, chocolate milk, almond milk, oats milk. There's so many different kinds of milk, right? And so we ask that, and we ask how much. Was it half a cup, a whole cup, how much? And we give you examples so that you know and can really estimate what it is. And we give our participants food models too, so that they're able to see and understand what we're saying, so that we can again get back to that standardization for them to understand how much it is to give us a better estimate. And from there, you can understand and get data to say how much fruits or vegetables have they eaten over the last 24 hours or so. And the other thing that we do to contribute to that is that we know that what we eat Friday, Saturday, Sunday, Monday is going, or Friday, Saturday, Sunday is going to be completely different, right? So we randomize the days that we ask people to provide their dietary recall and what they ate. Because if I interview everybody in this country on Wednesday, I'm only going to find out that everybody had Taco Tuesday the night before, right? That's not going to be helpful to anybody. And so what we want to do is we want to randomize all these days so we get a really good understanding of what everybody's eating in America over the course of every day of the week.
Okay, thank you.
We really do have so many milk options. So I really appreciate you listing all of them out for us today.
I think I only did a fraction of them too.
I know, there's so many. Dr. Aziz, I see your hand is still raised. Did you have a follow-up question? Nope. Okay, wonderful. Dr. Nguyen, I'll pass it back to you then. I know there is some more questions and any other content you wanted to run through.
Absolutely. So let me do that. Let me see if I can share this screen. I have a quick PowerPoint that I want to show of everybody. Again, it's a very brief one, but I want to be able to share it with you. So hopefully I'm going to be able to pull up your screen too. Let's see, do you guys see my PowerPoint? Great. All right. So I think you guys get a sense of what's going on, but I want to share with you what makes NHANES really unique, right? So you heard that we're unique because we do both interviews and physical exams. And so why is that important? So if some of you have heard of BRFIS, it's a telephone survey that CDC helps states with, where it can be tailored to do surveys about and ask, similar to what NHANES says, health behaviors and other health questions. And it's all telephonic, so everything is relied upon the participants really telling us what, and reporting to us what their information is. And so going all the way back to 2000, BRFIS asked folks, how tall are you and how much do you weigh? And given those data points, they were able to estimate the prevalence of obesity at that point in time. And with what we reported, they saw about 20% of people were obese. You bring in NHANES at that same period of time, and you can actually measure them and get them onto a scale and actually measure their height. Guess what? There are a lot more heavy people in this country than actually reported or known about, right? So having NHANES and coming in to be able to do that very objective portion of the examination is really important for us to really understand where we're at with the nation's health, right? It's what I call being able to diagnose the undiagnosed. We can ask somebody in the home, do you have a history of diabetes or high blood pressure or high cholesterol? And they can say yes or no, and you move on. But then when you bring them to our exam center and you're actually able to draw labs and see if that person has a really high hemoglobin A1C and has had very high diabetes or high cholesterol or has even hypertension that's really, really concerning, we're able to help them. And we're able to help them not just at the individual level where we can say, you have high blood pressure, you need to be seen. But then at the population health level, we're actually able to take that and really see if there's a subset of our population that has a concern that we didn't know about. We can take that data and translate it to the foot soldiers who are in the trenches, who are the primary care providers, to really say, you need to screen these folks more. They are more at risk to have an illness or a disease, whatever it is. We hopefully do something that's actually really easy to make them healthier. If we make them healthier, we make their families healthier. We make the whole country healthier, right? So it's one simple thing, and you can extrapolate it to much bigger. But it really is important to be able to have this objective data that NHANES prides itself in providing the country. So you got a little sense of what our trailers look like then, and you already saw the video, so I'll pass through that. But I wanted to give you all a sense, as we alluded to a little bit earlier, about our food models and what we ask and how we ask it. So you can see it there where we give them a huge spiral notebook of all the foods and drinks and all that they can do, or they do, and we give them sizes, right? So if somebody says that they ate pizza, we just don't say, okay. We ask them, how big was that slice of pizza? What was on that pizza? Where did it come from? Because if you say you had pizza from Domino's or Pizza Hut, the USDA already has a set caloric intake amount that we know how much was there. But if it was homemade pizza, it changes, right? Where did you get the crust from? Where did you get the meat from? Where did you get the pepperoni from? All of these questions contribute to really understanding what we've eaten in America and the caloric intake that we've had. If you had a cup of coffee or a cup of milk, how big was that cup? How full was it? How many did you have? Same thing for tea, juice, sodas, water. How big was your glass? How full was it? How many did you have? And then the thickness sticks. This is the best part. Like if somebody reported they had chicken or steak or a pork chop last night, we're like, great, this is how big it is, right? But how thick was it? Because we know, again, that contributes to how much protein you've taken in, how much calories you've taken in, all these other things. It's all based on the thickness. And so we go into that much detail with our participants to really get a sense of what they've eaten, how much they've eaten, so that we can put that into our data set. Over the years, things have changed, right? There's some things where if you look at the top, the arrows go all the way across. It's what we call our core NHANES components. And we've always done blood. We've always done blood pressure and body measures and depression and our dietary intake. But things come and go, right? So you can look at it. And I always, if you go about 2/3 of the way down, you see something called taste and smell with 1X that we did in 2013 and 2014. And what we did there was, if you guys remember from some of you when you were in elementary school and kindergarten, when you did well in school, you got a sticker, it was a scratch and sniff, right? You can scratch it, it smells like roses, or it smells like strawberries and chocolate and vanilla and all these other things. And it's great. And we did do that. But we also tested for gas and smoke, because we know how important that is, that as people age, we know that you might be at risk for losing that sense of smell. And not knowing or not having the ability to smell a gas leak or smoke in your home is super important. And so we were able to do that. And really, it gives you another idea of what NHANES can do and how we can contribute to not just public health, but public safety in our nation. Couple other things before we go into more questions is NHANES and public health. As you heard, like as a pediatrician, I never heard about NHANES, and I never knew where these growth charts were used, even though I used it every 10 minutes of every hour of every day. That's where it came from. All this data came from NHANES. And what I tell folks now, when I talk to them and try to, if people call and we try to convince them about what NHANES is and get them to participate, is all this data for these growth charts back in the 60s all the way up to the 80s, right? And it's really one of those things where people will say, well, the nation's gotten heavier. The 50th percentile is no longer the 50th percentile. And my answer is, yeah, you're right. But that's not what these growth charts are for. These growth charts are for us to understand what normal growth is for that child, right? I'm going to use my son as an example. He's 0 percentile for height, 0 percentile for weight. Why? Because my wife and I are 0 percentile for height and weight, right? So if he grows and he ages and he suddenly falls off the chart for whatever reason, or gets up too much where either his height stops growing or his weight goes up too much, we're able to see and track that and understand, do we have to do something? Is there something wrong there that we have to track? Because that's what it's there for, to really track normal growth. Because we know what's normal, we want to be able to identify where it's not normal. I do a couple of tweets, but I think this tweet is the best example of what NHANES means to the country. If you look at the highlighted portion, this researcher said, I'm anxious to see where the nation stands. A major public health report card. Did we correct alarming increases the past 2 years with billions of dollars of products, research, and education? And that's exactly what NHANES does. It informs the stakeholders, whether it be at the national level, the state level, the local level, of where we're at with health in our country. And from our data, that drives public health policy. That helps drive clinical guidelines and public health guidelines to say, this is where we're doing great and we can reel back a little bit, or this is where we're not doing great at all. And we need to devote more time, money, attention to this so that we can make this part a little bit healthier in our nation. I want to talk a little bit about industry, right? We've talked a little bit about food and nutrition while we're here, but NHANES is all around us. And that's one of the things that we tell our participants is, you may not know it's there, but it's there. You'll see it and influence you. You heard a little bit about lead and how our data led to the removal of lead from gas and paint and how that has made us so much healthier. But if you look at this publication, you know, the nutrition impact of mushrooms, who cares about mushrooms? If you look at the red box at the bottom left-hand corner, I'll tell you who cares. It's the Mushroom Council. They use that, right? If you look and see, they actually did a press release using NHANES data to say how important nutrition and mushrooms are and how everybody should be eating it. It's one of those things that's really, really important. Another one, you guys are probably all familiar with this pasta company, right? Apparently, they used our data and they found data that contributes to their narrative of life is better with pasta, according to NHANES, right? Eat like an Italian. That's what the NHANES study shows. I don't know where they got this data from, but that's what it's on their website and what they're promoting, right? And again, NHANES is all around you. They're using our data to really better understand what America is doing, what America is eating, and that's how it contributes to how they impact us and influence us. A little bit more about clinical guidelines, right? Where we talked a little bit about health disparities and health inequality or health equities here. And so this publication was just a couple of months ago, where it's folks were able to look at trends in racial disparities in hypertension. And I'm going to concentrate on the main findings here. It says, despite receiving more antihypertensive medications, Black people have poorer hypertension control compared to white people, and the poorer hypertension control among Asians and Hispanic people is associated with lower hypertension awareness and treatment compared to white people. Again, that goes back to what we were saying at the beginning of being able to ask people in the home about their health behaviors and their health history, and really seeing how it's translated and what it really is when they arrive to our mobile exam center. We can see where these inequities are, where these disparities are, and really contribute and hopefully message more folks to make sure that we're able to screen those folks out a little bit better, make them healthier. A little bit about our prescription meds. One of the questions I had is what kind of qualitative and quantitative data does NHANES ask? And one of them before, we couldn't do it and had to take it out for NHANES, but what we did in the home before was we meticulously recorded every single medication and supplement that participant was taking. And for some folks, it's one or none, and others it's 20. But we sat there and we recorded every single one and put it into our database. And from there, you can see, the prevalence of prescription meds with depression prevalence. We can see how many people are doing those medications or taking those medications. And then a researcher was able to take our data and all the medications that we have and really know what the side effects are, right? And they were able to take a look and say, you know what, using NHANES data, a third of American adults take a prescription med that might have a side effect of depression. That's huge, right? For all the clinicians out there to know that impact and to know if I add on another medication, what is that side effect? To the other side effects that this participant is taking, it can have a really big impact. And NHANES data has been able to show what we're doing in the direction that we're going. And then probably one last thing about public safety is that NHANES data helps to inform other agencies. So if you guys have ever been on a small airplane, you may have heard the flight attendant ask somebody, can you move to this side of the plane or that side of the plane, right? How do they know that? Well, the FAA tells them they need to know what a standardized weight is. And what do they get the standardized weight? NHANES, right? It's this thing where NHANES data is contributing to the safety of our skies, right? They need to know not just how much gas to use, but to be able to do that weight balance control program for every single aircraft for all the airlines is super important to make sure everybody gets to their destinations safely. And one last thing, and then I'll open it up to questions. NHANES data in our anthropometric data, because not only do we do height and weight, but we measure everything. How long is your arm here to here? How long is your femur? How long are your legs? We measure all of that. And they've used this data to create crash test dummies, right? So in this example, it's a 6-year-old that they created. They used NHANES data to really get an understanding of the model they made. They compared it to our data for 6-year-olds to see if it's actually comparable and real for what a real child would be. And so again, contributing to safety in America using NHANES data. And what you can see is I can go on and on and on and on. But I'm going to stop there in the interest of time and answer any other questions folks may have.
Thank you so much for this breakdown. This was so helpful and also so fun to know that we have some data on mushrooms that was published by a council on mushrooms, and love pasta is backed by NHANES data. And we have some questions in the chat that I'll shout out quickly. So from Amelia, as different health and nutrition needs continue to be identified on the national and local level, such as the importance of having access to culturally important food that meet faith-based dietary guidelines, will future surveys incorporate questions that seek to understand the impact of these challenges on communities nationwide?
I hope so. It's definitely clear and evident over the last couple of years, especially how important that is, especially in our nation where there's so many different cultures. And so what NHANES does is before we actually open up our next survey cycle, so we change things every 2 years, as you saw, what we do is we have an open access where we invite organizations to propose questions and other components within our test to really say, this is what you need to ask, and this is why it's important at the national public health level. And so I think having that and being able to understand these issues is going to be really important. And so I don't know what's going to be in our next questionnaire yet, but I think it's one of those things that's definitely been talked about to make sure that we are definitely not only worried about social determinants of health, but actually the cultural components of that also.
Awesome. Another question, how long does the survey process take in the mobile clinic? And then a follow-up question, does NHANES make recommendations to see their family doctor, primary care provider for hypertension, diabetes, obesity, et cetera, after the results have been shared?
Absolutely. So yes, first and foremost, the mobile exam center is limited to about 2.5 hours. It's going to be a little bit less for kids who do less test results, but for adults, for the most part, it takes about 2.5 hours. Our home interview, depending on the participant, it's usually about an hour or so. Some younger folks, it's about an hour. Some folks who are a little bit older, it might take a little bit more time. It might run a little bit longer, but in general, it's about an hour. In terms of follow-up with medical providers, yes, absolutely, every single time. One of the things that we tell our participants, and it's on the cover page when we send results, is that the NHANES exam does not replace any other medical examinations. It does not replace your annual exam. We look at things at the population health level, right? So we look at, yes, height, weight, and blood pressure, and some of those vitals, but we do very intricate tests. We do a liver ultrasound. We do the DEXA test to look at bone density and bone composition. But we don't listen to heart and lungs. We don't do a neurologic exam. We don't do a musculoskeletal exams, and we don't do other tests that might be recommended for age groups, like for instance, breast exams for breast cancer, right? We don't do that. And so it cannot be replaced. It can hopefully supplement and add to what your doctor does, but it doesn't replace that. And so if there are any abnormal results or even normal results, we always tell our participants, please take these results to your doctor, and they can talk to you about whether or not these results are important to you or not important to you.
Thank you so much for that answer. A couple more questions that I'm going to couple together. Are we going to make changes in school lunches based on the studies to address the issue of obesity? As we all know, it's a challenge in marginalized communities and disparities of quality food in these communities. Also, kind of on a similar note, is there going to be any pressure on sports arenas to make changes on their food menu here? Rima noted that as a nation, we are addicted to our favorite sports, so that might be something to consider.
Not going to disagree with that at all. And I probably will have to admit that I'm actually guilty of that also. But with that being said, it's one of those things is that, do we hope to, as a pediatrician, as a medical epidemiologist? Yes. Do I hope that's going to happen? Yes. That's on me. That's my personal level. The thing about NHANES that we pride ourselves on is that we don't dictate what that change is. Our role is nonpartisan with no agenda. Our role is to objectively collect that data and release it to the public so that stakeholders and other leaders and health policymakers can take our data and understand where we're at with our nation. What the lawmakers do, the policymakers, the stakeholders do with that is on them. That's not our role. We may have thoughts about what to do, but and even bigger CDC has abilities to do that. But at our level with NHANES, we don't participate in that. We don't talk about those discussions at all, because that's not our role. Our role is not to say yes or no, good or bad. Our role is to say, this is what that number is. This is what people are eating. This is what's going on. And for others to be able to translate that. And sometimes it's difficult for us because in the few times we do publish, the editors will come back and say, well, what does this mean? And we can't tell you. We can just tell you what the numbers are. That's what we, as a federal statistical agency, that's all we can do. And that's what we pride ourselves on. There is no agenda for what we do other than to give you where we're at with health in America right now. So it's a non-answer answer, but hopefully you understand why we take the stance that we do.
Yes. Thank you so much. Out of respect for everyone's time here, I'm going to ask that if any questions you have that have not been answered or you think of any, please go ahead and send me an email and we will make sure those get answered. Also, this webinar was recorded or is being recorded, so that will be shared and published to our social media. So you will have all of these questions that you can circulate and revisit as needed. But just wanted to quickly say, thank you, Dr. Nguyen, for taking the time out of your schedule to spend your early afternoon with us. We are so grateful and have learned so much from you. I will be following up with some additional questions that we've compiled here. And then I will circulate those answers for everyone to have. But to everyone on this call, thank you so much again for taking the time to be with us. Your support is so critical for NHANES, and we are so excited to be working alongside each of you. For those of you who may not know me, again, my name is Ashila. I am the New Health Policy and Advocacy Manager with AMP. I'm based out of the East Coast, so I am on most of, well, not all of y'all's time zones, but Dr. Nguyen, I am on your time zone. But if there's anything I can ever do for you all, please reach out to me, and I'm excited to work with all of you.